if we look at these three types of abnormal rhythms. Okay, so one is tachycardia. Remember tachycardia, this one right here, that is a fast heartbeat. This is bradycardia, that is a slow heartbeat, and this is an arrhythmia, and that one is an irregular heartbeat. So take a look at each one of those and see which one you think is which. Okay, so if we look here, this one should be our tachycardia. This one right here should be our bradycardia, and this one should be our irregular one or arrhythmia. Okay, now, have you seen these before? This is a defibrillator. So this is a common treatment for life-threatening cardiac arrhythmia. So there's two different types. This one at the top here is called an automated external defibrillator, which is an AED, okay, AED. And that one's automated, whereas this device right here that you see on medical, this is a manual defibrillator. So they're both defibrillators, and they both are used to help re-establish a normal rhythm. So if somebody's heart is completely out of rhythm, this thing is supposed to help re-put it into a correct rhythm. So that should help. All right, so blood vessels. Okay, we know some of this should be a review. We know that the blood vessels are arteries, veins, capillaries. And then arteries are the vessels that carry blood away from the heart. So we always think arteries away from the heart, okay? So arteries away from the heart. And then veins are the things that carry blood back to the heart. So veins take blood back to the heart and arteries take blood away from. Now there's little things called venules. Venules connect to the capillaries, and then the little arteries are called arterioles. So little veins are venules, little arteries are arterioles. So if we look at the capillaries here, these are teeny tiny, right? And they penetrate all the tissues. They're composed of just a single layer of squamous cells, which means they're very, very thin. But they are super important because they allow the exchange of oxygen and nutrients between the blood and the tissues. So this is where it happens. It's a very, very important job that they have. So you can see that from the heart, here, we're carrying the oxygenated blood, and then you can see that this is where it's seeping into the tissue, and then the venule is taking it away and back to the heart. So it's taking the deoxygenated blood back to the heart to get more oxygen. Okay, so how do we control blood flow? Okay, this is a great diagram showing like this is kind of a normal flow. This is vasoconstricted, meaning constriction means to close, and then dilation means to open. So narrowing is vasoconstriction, vasodilation is expanding. And this can happen within the body anywhere. The body is smart. Remember, like when you have a cut, one of the first things that happens is vasoconstriction because the body's like, yo, we don't want as much blood to go to that area. So it's really, really smart in that sense. Remember when we were talking about cooling down the body, that the blood vessels dilate to try to get the blood closer to the surface to cool down. That's why some people get kind of red when they're hot. This is just to kind of remind you that the sphincters are little things. They open. That's like right here, precapillary sphincters. They open and they close as needed to help open blood flow up or constrict it, and that's its job. So blood flow through the veins is not super efficient. It's very slow. It's kind of weak. So it kind of, you know, it needs a little extra pumping action from the skeletal muscles to help it return to the heart. So that's why sometimes you see older people that have some really swollen legs. It's because of this. These valves in their veins have kind of given out as they've gotten older. So it's really hard to get that blood flow back up to the heart. And thus, it kind of pools in their legs, and their legs get larger, and the swelling kind of, we call it edema, when it stays in the legs for a long period of time. Okay, so some things that affect blood pressure. Cardiac output, so how much blood is coming out. The volume of your blood, so how much blood do you have in your body. 5 liters is the average for an adult. Your blood viscosity. Viscosity is how thick is your blood. So is there a lot of, blood vessels or a lot of blood cells in there, and it's very viscous? Like, is it very thick, or is it kind of more watery? And then peripheral resistance. What does that mean? That means, if this is the artery, do I have a bunch of plaque on the outside where it's going to be difficult for the blood to flow through there? That affects blood pressure as well. Okay, so we talked about blood clots. Remember, a thrombus is a stationary blood clot, and that's it. That can happen if the blood does not flow properly through the veins. So if the person doesn't move a whole lot, sometimes it's difficult for the veins to move that blood flow. That's why it's really important for people to get up and to be moving around and exercising, or at least walking, to try to get to help the skeletal muscles compress the veins and move that blood more towards the heart. If we're not doing that, then sometimes it's difficult for those that blood to get back to the heart, and it starts pooling up, and that's when you can get blood clots. Varicose veins occur when blood pools in the veins. Now, this isn't necessarily due to anything, not due to, like inactivity or anything like that. It's just what happens is if these valves are opened, they can cause, it almost looks like a swelling of the veins there. They can be painful as well. So there are some treatments to help that, but basically what you're seeing when you see this on a person is it's blood pooling in the veins. Some of the major blood vessels that you need to be aware of, one is the aorta. There's the ascending aorta, there's the aortic arch, the descending aorta, and the abdominal aorta. This is the largest artery in the body. This is the one that leaves that left ventricle. There's the pulmonary trunk. This splits into right and left, and both lead into the lungs. So that's a super important one. The pulmonary veins, again, super important because that's what's going to bring the blood back from the lungs to the heart. And then the superior and inferior vena cava. These return the blood from the head. The superior, the superior obviously goes with bringing the blood from the head, and then the inferior from the lower body and everything else. So you can take some time to, sketch this out, practice. You should know all of these parts by now. Now, if we look at the branches of the aorta, you can kind of see that if you look at the aorta, there's all these little, there's these arteries coming off of it. So what are those? Branches of the aorta. There's the coronary arteries, and that supplies blood to the heart itself. Because remember, the heart is a muscle, so it needs blood too. The brachiocephalic artery branches into the right subclavian, which supplies blood to the arms, and then the right common carotid, which obviously that's a bicarotid. So there's two carotid arteries. There's a left and a right, and the left common carotid and the right common carotid both go to the head. So if you can feel on the left side or the right side of your neck, that where you feel the pulse there, that is your carotid artery. And then your left subclavian artery supplies blood to the left arm. So the right obviously goes to the right and the left goes to the left. So again, here's a nice picture showing you, look at that, there's the coronary arteries right there that bring blood to the heart. This is the left subclavian and the right subclavian going to the arms, going to the head. And then you can kind of see that this ascending aorta and the descending aorta, if that big aorta is going to lead down and it's going to go into the abdominal aorta, which is then going to lead down into femoral arteries and a bunch of different other arteries for the lower body. So here are some disorders of the circulatory system. MVP, mitral valve prolapse. So this is when the valve shifts out of place, creating kind of a clicking sound at the end of a contraction. So a lot of times what happens is people will go in and the doctor, you know how the doctor always listens to your heart, listens to your lungs. Well, if they kind of detect a little clicking sound, we know that might be a mitral valve prolapse, meaning that there's that valve, that mitral valve is got a little problem. There's something called a heart murmur. A heart murmur is an extra or little unusual sound heard during a heartbeat. Not necessarily dangerous, but murmurs can be like very faint or very loud. They kind of sometimes have a swooshing or a swishing kind of noise, and this may or may not be a valve problem. Sometimes people have heart murmurs their whole life and never even know. Sometimes it can be more significant that requires heart surgery, if it is like a little hole or a leak in the valve, that would be a problem that would need to be fixed. All right, so this is what I was talking about with the leaking valve. So you can have what's called regurgitation. So regurgitation means backward flow of the blood. So when valves close, nothing is supposed to go back into it. There should be no backflow. Like you said before, it's like a tube of toothpaste. When the toothpaste comes out, it is not supposed to go back in the tube. So over time, this can weaken or enlarge the heart, so it becomes a problem. Like look at right here, you can see that valve has not completely closed. It should be completely closed, and if it's not, blood can leak back in. This is sometimes they call it a leaky valve. It just means that instead of it completely closing, a little bit is coming back out. So we can replace the valve. Now, you can replace it with a biological tissue, meaning that we can replace it with, sometimes they use pig valves even for the heart, but you have mechanical ones too. So this is an example of a mechanical valve or a biological replacement. So biological meaning it's coming from another living thing, mechanical meaning that like we made it and it's made of titanium or something like that. Okay, so transcatheter aortic valve replacement. This, obviously you guys can read this, but what happens is we can see that there's a really small incision made in the groin, and there's the little catheter, a little wire